Welcome to the Face-to-Face. I'm your host, Genevieve Lefebvre. The Face-to-Face is a bilingual series of video recorded here at the Société francophone de Maillardville. We acknowledge La Société francophone de Maillardville operates on the traditional, ancestral, and unceded territory of the Coquitlam. We thank the Coquitlam, who continues to live on these lands and care for them along with the water and all that is above and below. Today we're welcoming Becca Yu. Becca is a speech and language pathologist. She's also the owner of Citadel Speech and Language Services and past president of the BC Speech and Hearing BC. Welcome to the Face-to-Face, Becca.
Thanks for having me.
So today we're going to be talking about a topic that I think we hear here and there, specifically if we need the help of a speech and language pathologist. So the waits are long, and we want to touch on if there's any solution, what can we do, and also we want to know who are the people that actually need a speech and language pathologist.
Mm-hmm. So a speech language pathologist is a medical professional who specializes in communication, so speech being more of the sound part and language, as well as swallowing. So I always say kind of everything in around here we work with, and anyone could use a speech language pathologist depending on what their needs are. So we see people of all ages, from babies, from the NICU, they might need some help even with swallowing and making sure that everything's working correctly if they were born prematurely, to adults and seniors in their later years for cognition, so dementia, Parkinson's, just cognitive decline, and everything in between. You know what most people think of for SLP or speech therapist, we have lots of terms for what we're called, is that you think of working on speech sounds, a kid that says wabbit instead of rabbit, or a child who stutters, but we do a lot more and help a lot of people.
Okay, so if you think that your child should be saying certain words, a certain amount of words, and now you're starting to think, I should get help, or I should look into it, and you're not into the school system yet, right? So you put yourself on the list. How does that work?
So in BC, so our healthcare systems through our province, so in BC, there's a couple different ways to approach that. So for a parent who has a young child, they could go to their public health services or child development center, and there's usually services for kids who are preschool, so 5 and under. Our public services, they do sometimes have a wait. There's another option as well, which is where my company comes in, would be private services. So there's also SLPs that work privately that would also be able to complement those services, sometimes be able to see a child sooner, or just different capacity depending on what the needs are.
So how are speech and language pathologist services currently here in the Tri-City and across BC? What challenges are faced? Yeah,
so across our province and across Canada, there's been quite a shortage in healthcare professionals, and that's no different for speech language pathologists. Is that there's been a shortage. I've been practicing for about over a dozen years, and from the time I started, I've been told that there's a shortage, and it hasn't gotten any better. I've been in a position to be hiring SLPs for almost the last 10 years, and I've slowly watched, each job posting get from a few applicants to sometimes crickets. And so, there's just a shortage of those professionals in the area to be able to fill those positions.
So who are the most impacted by the lack of speech and language pathologist services, and what specific needs do they have usually?
So I mainly work with children. I do see a lot of need for kids. They're starting off in life. Babies are sponges. Toddlers are sponges. They're learning, and sometimes they need a little bit of help. And that's where we come in when it comes to language development. For those kids, if they don't receive the support early on when it's first noticed that they may have some language difficulties, is that gap might continue to grow. So if the gap is growing, then it becomes harder to close that gap later on. So if they're not seen before they enter school, unfortunately our school services are also have a wait list as well. And so sometimes they're not caught right away, or the access to those services are not there.
So with the school, how does that work? Is it the school has their own speech and language pathologist, or they work with private practices?
So for our public school system, usually it's done by district. So there's usually hired by district, and then the school SLP will go to several different schools. And from there, they'll see what students may need support and determine from there how to support them. Thing to note about that is that because, say, a school SLP in the Tri-Cities is assigned sometimes 4 or 5 schools. So 5 days a week, they may have 4 to 5 schools. They're getting about a day at each school. If there's a couple hundred children in each school, about 1 in 10 of those kids need some sort of speech or language support. So you can see how that snowballs to a lot of children, and those caseloads grow, and there really is no cap. There is no limit to say, when you have this many kids, we have to hire somebody else, or that you stop taking on kids and clients and someone else is going to come in to support. So that causes a lot of healthcare burnout. The professionals trying to see everyone, they see the need, but they as one person can't support all that need.
Wow, that's a lot of people to take care of only in one school. If you think like 1 in 10, that's a pretty big ratio.
Yes.
So can you explain the waiting list of these services in the Tri-Cities, and I guess BC also, including the wait time and contributing factors to why is it so long? Why does it take so long? Why are there so few of you guys,
Well, there's a couple parts to that question, so you might have to come back to me on a couple of those things.
Okay.
So in terms of the wait list, it's going to depend on organization. So the wait list for one public health unit in one region, so in the Tri-Cities, would be different than the one, say, in Vancouver or in Langley. So there's going to be a different wait time. A lot of times what I've seen is anywhere from 3 months to a year to wait for an initial assessment. So that assessment will tell a family if their child is delayed and in what ways. And so at that point, the professional, the SLP, would let them know the wait list of what the services would be recommended would be. So there's kind of a series of steps of usually how to get seen on the public side in public health. And then for our school system, there isn't really a wait list from my understanding. There's the SLP is aware of many of the students, and they're usually made aware by their classroom teacher or by, say, their principal if the parent had spoken to the administration about the needs that their child has. And from there, the SLP will try to accommodate for as many of the students as possible. For private practices, for myself, I have to say we do have a wait list, and I've been watching private wait lists grow in the last decade. What we try to do is a couple of things to mitigate that. We try to hire a new SLP. When we see a need, we go looking for a new SLP, right? That's not always easy. Or we look for alternatives. So there are lots of students who, because the SLP is a master's level professional, there's students who want to do that eventually, and they need to get that experience, or they need that exposure to learn if this is the profession for them. A lot of times they'll volunteer through public organizations or a company like mine, and they can work as assistants under the supervision of a registered SLP. So that's another alternative to kind of help support a few more when there's a lack of professionals that are qualified to do the work. In terms of kind of why there's, a lack of professionals, I think it's a accumulation of lots of things in our healthcare system over many years. And sometimes it's, hard to predict how many people are going to need those services or how that's going to play out. The government's not looking at a year, they're looking long term. And they're trying to, but it's not always easy to kind of predict what those needs are. And there's lots of different systems that work together. So our program at UBC has approximately 40 seats for SLPs to graduate a year. We need many, many more than that right now. So 40 coming out can very easily find a position, which
Because
is
those 40 seats doesn't mean they're all staying here in British Columbia.
luckily the statistic is well over the 90%.
Oh, that's very good.
It's very good.
Wow.
It's very, very good. Our school has a very good retention rate within the province, but 40 when there might already be 40 positions open across the province, and I might even only be looking at our public system across childhood all the way into adulthood, that we're just making small dents. There is lots of professionals from other countries waiting to work sometimes, and we've heard that the government is working on those programs. So nurses and doctors, now internationally trained ones, are starting to get their licenses expedited. We're looking to hopefully see SLPs get into that program as well, because there's many individuals, and I've spoken to some in my position with Speech and Hearing BC, is how hard it is to get licensed, and then the transferring of licenses between provinces and the cost and things associated to that can be a deterrent sometimes to be practicing. So there are sometimes waiting professionals that could be doing the job that aren't able to at this point.
So is there a new solution or help for families that it's taking too long, let's say, with the school, and they don't have the money to pay privately?
Well, our public system does usually have a few options, particularly those in those preschool years. So sometimes they run group type activities. So one program that's used often is the Hannon's It Takes Two to Talk. It comes in a book. It's usually a group run, so parents also have the support from each other, and it's usually led by a professional like an SLP. So you're able to learn strategies that way. You can while not everyone can pay privately, some people also have extended healthcare benefits, particularly through work, and there'll be a little bit of access there, and you may be able to access a little bit of support that way privately if they have extended benefits. At this point, it doesn't help your child immediately, but talking to your government official, talking to your MLA for the province, letting them know what the difficulties are in terms of access and how that's impacting your family. That is, a big part in their job, and hopefully then be able to gain some more support in, expanding those positions.
So is there any way the government could do something any different than what they're doing right now?
I think there's a lot of programs that have started, like the expedition of international licenses, that could help have some immediate relief, that would give more professionals into the field who are already practicing. I remember talking to somebody, they had been practicing for about 25 years. But because they came from a country that there's no direct kind of correlation to our programs and stuff, the college that regulates us wanted all the syllabus from the classes this person took 25 years ago.
Impossible.
This person taught these classes at one point in their career. And so, that's a barrier. And or taking a break. As women, sometimes we may take breaks to take care of those that we love. If they take a break from the profession, then it creates barriers into re-entering the profession. And when the profession is 80 to 90% women, that can create a lot of barriers.
And that's a good point. It's true. When you stop and you want to start again, if you let go your license, let's say, like now you want to go back, you have to do all those tests again. How's that work? Same way?
For ours, there's what's called recency of practice. So there's a certain number of hours required over a 3-year span. And it doesn't sound like a lot, 750 hours. But depending on the capacities of somebody, I talked to a young mom who had 3 babies across about 4 to 4.5 years.
Wow.
So in order to take mat leave and support her children, then wanting to come back to work, in that 3-year span, they didn't meet that requirement and was in jeopardy of losing their license. This is somebody who had been practicing for years. This is a person who, would like to take the time to raise their own children and was put in a very difficult position of, do I lose my career or do I need to cut back from my own family? And so, I understand how important it is to be practicing and using the skills, and, that is a part of being a professional. But I feel, as somebody who's been practicing for a while, there's different ways to keep sharp with your skills than physically sitting there or working with somebody. There's I supervise a lot of young professionals in my position now. I spend lots of time problem solving, and that should say something about somebody's abilities versus just physically doing the job.
Now, can you share some positive stories, like from speech and language pathology interventions, and how they've benefited individual? If you have something specific to the Tri-Cities, that would be great.
I have been working with a number of organizations, and this is in regards to like making sure that our funding and access and everything. So there's been a lot of funding changes in the province, and our community in the Tri-Cities has been incredibly supportive. The current changes in the MCFD, so Ministry of Child and Family Development funding, which was originally accessed by autistic individuals, as well as there's another program called the At-Home Funding Program. That was all being changed. It hasn't impacted the Tri-Cities directly, but numerous organizations have come together, including myself, to have those discussions already, so that when the changes do come to the Tri-Cities, we're making sure that we're ready and we're working as a community to make sure that kids are supported for that. So, it's still continual work, but the last time we met was in the summer, and there was about 16 organizations. And so that says a lot about our community, and those in the Tri-Cities should be very proud to be in such a community that would work together. This is private, public, organizations all working together.
Now, share us one of a little miracle story, without going into details of names or anything like this, someone that couldn't speak, couldn't say certain words, and after X amount of visits, they were already starting to doing certain things. Do you have a story like that?
Oh, I've got lots. This is my favorite part of the job.
Yes, of course.
It's my favorite part. A story I share a lot, because it's probably my favorite story, is I worked with a little child. They were under 2 years old when we started, and I remember sitting in one of our first meetings, and the parent said to me, "My biggest fear is that they're never going to talk."
Oh, wow.
This is under 2 years old, but they had a couple of different diagnoses, so it's a possibility that they wouldn't talk. Worked with them for a year, and then we had another meeting, because we meet regularly, and I asked the parent, "What's your biggest complaint, concern, what's going on right now?" Said, "The kid talks too much."
Oh, too much talking, which is not very common, right?
No, too much talking. And I was like, so I did my job. And the parent just started laughing. And, those are the types of stories that I love to tell, and what makes my job really fulfilling, and a really great career for somebody who likes to teach, who likes medical professional. I was looking at doctor, teacher, those types of things when I was looking at a career, and this kind of married all those things together for me. I work with a lot of kids who don't end up talking. Talking doesn't seem to be, using their voices doesn't seem to be the main mode of communication. And sometimes I'm getting these kids at 6, 7, 8 years old, and we can tell they can communicate, but the voice isn't coming. They're not really able to be understood that way. And so we use a lot of technology, so augmentative and alternative communication, or AAC. You might see kids with iPads with lots of buttons on them. And so one of my favorite things is introducing that and doing those assessments, because sometimes it just opens this world to the kids. They look at these buttons and they hear the word go. They hear the word no. No is the favorite word, right?
No.
It's for toddlers, it's their favorite word,
oh, yeah,
right?
Of course.
I have so many more stories, and sometimes even stories from colleagues. So like I said, I work mainly with children, but I have lots of colleagues that work with adults. And sometimes after a stroke, learning to talk again or learning to eat again can be really, really difficult. And so hearing from colleagues there is that, getting their patient to be able to eat their favorite meal again and be able to eat it safely is, such a amazing look of joy from them, because as a society and with many cultures, sharing food is such a big part of how we connect. And so for an adult that had lost that for a while, some of my colleagues were able to work with them to be able to do that again.
Oh, that's such a good one too. It's true, after strokes, after different illness, cancer, surgeries, there's a lot of learning things that we learned already, but it's I just can't even imagine learning something as an adult. It's completely different, right?
Yeah, losing that for a while.
Yeah,
that
losing
you
it.
Took it, almost, it was so innate, right? It was something you just knew how to do. We don't really learn to eat. We don't really think about it. But then when you lose the ability, it's a huge loss.
I can totally see that. So what are specific groups or community facing challenges in accessing these services, and what focused initiatives might help address those disparities?
Well, I mentioned the group around the Tri-Cities.
Yes.
So, lots of organizations here are working together to try to access more funding, try to build a better program so that more people can access funding. On my work there, what I've noticed and what I hear is that there's just so many different difficulties, people who need support, children and youth that need support, that just never have access to funding. So I mentioned in our province, there's autism funding. So you need to have an autism diagnosis to that. It's very, very specific. The at-home funding program is evaluated based on self-care skills. So it's based on a significant delay in the ability to eat, dress, bathe, and like care skills. So it leaves out a lot of diagnoses. So a child who is delayed in language and language only, not autistic, doesn't receive any funding. So if they're waiting on the public wait list and there is a bit of a wait in their community, they're just waiting if they don't have another government funding source to access those. When kids are in school, find out that learning disabilities in general do not have any type of funding attached to it. So dyslexia, ADHD, they all need support too. Working on cognitive skills, so planning, making sure that they're doing their tasks in order, being able to start tasks. These are all things that an SLP can help work on, but unfortunately there isn't any funding for these children to do that. So those very specific diagnoses and deficits that we see are the only ones that are receiving funding right now. So it leaves this whole group of children without the same access, this same type of funding. As well as, we talk a lot about children, but adults in general do not have any extra funding. They can access support if they're in a hospital, say after surgery or after a stroke or cancer. But once they're out in the community, there isn't much in terms of those funding sources that we see with children, even though they're limited.
I can see with the adult, it's not as easy to find help, and I'm sure the families will push for you, but it's not everybody that has a lot of families, and that can be very difficult for adults learning to speak and learning to...
And different understandings and cultural differences. And so sometimes, conversations we have are with multiple family members or a whole family meeting, because one person thinks that they will become back to normal if they can, start services. Another person is like, no, they're not going to be back to normal, their usual self before, say, a stroke, but they can still gain more skills and independence and, that quality of life, and that may differ. And so you're almost playing kind of referee and teacher to teach a family what to expect and what the outcomes might be and things like that. So there's a whole other layer when it comes to working with your student, your patient, your client, and then their family, their loved ones.
So what happens if we need a speech and language pathologist, but in other language than English? Like my little one goes to French school, I might want to have a French speech and language pathologist. So that brings another layer of how hard is that to get someone that actually can maybe help you in the language you need?
for sure. It depends on what the needs are, and if they're language specific. So usually if there's a language delay, overall delay, it's delayed across all languages. So any strategies that you learn for one language, you can kind of carry over. So, if I can only speak English to you, but you're speaking French to your child, if I say, well, you can add a word to what they're saying so that now there's two words. French and English works the same that way. We're building complexity to the language. So you just be able to, translate that to the language that you are speaking, because the strategy itself is not language specific. In terms of finding an SLP that may be bilingual or multiple languages, it isn't always easy. The association that I've been a part of, Speech and Hearing BC, their website under Find a Professional does have an option to click on different languages.
Oh, good.
So you may be able to find someone specific to the languages your family speaks, to help support a specific person that has a language need. They say an adult, right? Say sometimes they may only speak another language, and so figuring out how to work around that. So sometimes translators are necessary. Through our public healthcare system, there is an access through for translators too. So that can be very, very helpful.
I can see that. So one more question before I let you go. I want to know, if we are teaching 1, 2, or maybe 3 languages to a child, is it because the children is learning more than one language that you could have a delay in language, or it has nothing to do with a child learning more than one language at a time?
So that's a really good question because it comes up all the time. Funny enough, my parents said, well, we got to be careful how we expose languages because it might cause a delay. I'm like, did you not put me through school for something? So no, your child will not be delayed for exposure to more than one language. That's a myth.
Oh, good.
So your children are fine. But what we do have to consider, and this is where, if you're wondering, a bilingual SLP would, be helpful, is you have to count the words across all the languages. So if we say at 18 months, the milestone is 10 words, can't just count in English. You can't just count in French. You have to put them together. And then you determine how many words they actually have. So it can be helpful to have somebody that speaks your languages, your family's languages, because sometimes the SLP will catch words that the parents may not have caught yet because we have that trained ear. It's like, well, I actually think when they go ba, they're referring to this. I've heard them say it several times and they're always picking this up or playing with this, and we can count that as a word, even though it doesn't sound anything like what the actual word is. So, don't worry if you want to expose your child to more than one language, if your family speaks more than one language, if the grandparents speak a different language and they're the main caretakers, that's not going to delay your child. All the research and what we see in the statistics is people who have exposure and can speak more than one language generally come out with advantages.
Okay.
They're able to connect with more people. Jobs look for people who speak more than one language. Our government looks for people who speak more than one language. So there's generally only advantages. Now, if they're delayed, you can still speak all of them. Just making sure that exposure is there for the different words, because if there's imbalanced exposure to languages, they'll just pick up on generally the one that is most prevalent. So here in Canada, around here in BC, in the Tri-Cities, English is spoken for a lot of people, and so English ends up being a dominant language for lots of the kids, even if they're exposed to other languages.
Yes, absolutely. So Becca, do you have a takeaway message for everyone out there that's looking for service and having a hard time finding services?
If you are wondering about, your loved one's communication abilities, go speak to a speech language pathologist. There is a way to find someone. You may have to make several calls or get on a couple of wait lists, but there's no harm in getting on that wait list. So if your child you're unsure, get on a wait list for public health, because that also informs them that there's a need there. Mm-hmm. There's a need there, and that if there isn't enough people to see it and the wait list is growing, we need more funding, we need more positions, and that's what's going to get more services for our area, for the Tri-Cities. Funny enough, what I noticed, a lot of young professionals like to move to Vancouver because it's the city, right? And we do a lot through the government and stuff, trying to get people to work in rural and remote areas. But the Tri-Cities isn't the city, and it isn't rural remote. So sometimes it feels a little like we're kind of left in a gap. We're kind of this funny area where it's harder to find those services. So talking to young people about different professions and getting them to take a look at this as a profession can be really helpful to help support that increased need that our province is seeing.
Beautiful. Well, thank you so much, Becca, for joining me today on the Face-to-Face. And from the Tri-Cities Community Television, la Société francophone de Maillardville, and myself, Geneviève, see you next time.